Good morning, sir. I am Marvin Batasinin from the BSRT3B, and today I will be performing the arterial blood gas analysis. But before that, let me define first what is arterial blood gas analysis. So, ABG analysis evaluates gas exchange in the lungs by measuring the partial pressure of oxygen and carbon dioxide and the pH of an arterial sample. So now let us proceed to the special equipment that a respiratory therapist must have. So an RT must have arterial blood gas kit, which compose 1 5 ml glass or plastic syringe with rubber stopper or cup, 122 gauge by 1 inch needle short bevel, 120 gauge by 1.5 inch needle, 2 sterile gauze pads, 2 alcohol prep pads, 1 adhesive bandage, 1 patient label, 1 sterile field, povidone iodine prep swabs, 1 plastic bag or container with crushed ice, 1 ml ampule sodium heparin, local anesthetic optional, 1 ml syringe with 25 gauge needle optional, and laboratory requisition. Those equipment that I've been mentioned was unfortunately not available in our place. So I decided to make an alternative equipment just to make this video. So now let us proceed to the procedure. So first, do the hand washing because it reduces the number of microorganisms residing on the surfaces of hands. So assuming that I've already washed my hands, now let us proceed to the next step, which is to read doctor's order to obtain pertinent data. Next, instruct patient regarding purpose, procedure, and responsibilities. With this, information may alleviate hyperventilation that when present might alter arterial blood gas values.
Good morning, ma'am. I am Marvin Batasinin, your respiratory therapist for today. May I know your name, ma'am?
I'm Angelica Bitato.
Ma'am, are you aware that I'll be doing your arterial blood gas analysis this morning?
Yes, sir.
Okay, ma'am, kalma lang po tayo, ma'am. Magsa-start na po tayo. Okay, so before we're going to proceed to another procedure, let me just remind you that I'll just be doing this just to check the pulse of the patient. But in getting the sample, I'll just be using the cucumber. Okay, so for the next procedure is to select radial artery as first choice, except in the case of multiple radial artery punctures, hematoma, occlusion of ulnar artery, history of circulatory impairment to extremity, or cardiac arrest. The radial artery is a small artery, however, it is easily stabilized as it passes over a bone groove located at the wrist. The percutaneous puncture and pressure control are enhanced by the anatomical landmark. Perform the Allen test or modified Allen test, or use a Doppler instrument to determine ulnar and radial artery patency. Collateral circulation to hand is provided by the ulnar artery. The Allen test asks for ulnar artery patency. Next is position patient. Use a semi-recumbent position. Elevate and dorsiflex patients, wrist slightly using a small pillow. Dorsiflexion of the wrist moves the artery closer to the skin surface, making the artery easier to palpate. Next is rotate patient's hand until pulse is palpable. Next, heparinize syringe and needle. Assemble 22 gauge short bevel needle on syringe. A short bevel needle diminishes the risk of overshooting the artery during entry. Prime syringe and needle with heparin, leaving only enough heparin to fill dead space. Priming the syringe with heparin prevents specimen coagulation. However, any heparin in excess of that needed to fill the dead space will lower the pH and the PCO2 of arterial blood. So assuming that this is a heparin, Next, eject all bubbles from the syringe. All air must be ejected to maintain accuracy of blood gas values. Next, prepare the site and fingers used to palpate site. So assuming that this is the patient's arm. So next, cleanse selected site in circular motion outward with povidone iodine prep swabs. Allow to dry. Drying of povidone iodine solution reduces risk of local infection or systematic sepsis. Next, cleanse site with alcohol swab. Allow to dry. Alcohol removes povidone iodine coloring from site and thereby increases visibility. Puncturing through a moist alcohol-prepared site can increase pain. Next, perform percutaneous puncture of selected artery. So locate pulsating artery. Stabilize artery by pulling skin taut and bracketing the area of maximum pulsation with fingertips of free hand. Puncture skin slowly, holding syringe like pencil. Advance needle slowly with bevel upward at approximately a 45 to 60 degree angle to the radial or brachial artery. And for the femoral arterial puncture, a 90 degree angle is used. So next, a slow gradual thrust will promote arterial entry without passing directly through it. Enter at angle comfortable for stabilizing your hand. Certainty of position is more important than entry angle. So pulsation of blood into the syringe verifies that the artery has been punctured. Flashback occurs readily with a glass syringe. Gentle aspiration may be necessary with the plastic syringe. So if puncture is unsuccessful, withdraw needle to skin level. Angle slightly toward artery and re-advance. Next is obtain a 1 to 3 ml specimen. This amount allows for rechecking and additional studies if necessary. Next is withdraw needle while stabilizing barrel or syringe. This prevents inadvertent aspiration of air during withdrawal when using a glass syringe. Next, apply firm continuous pressure to arterial puncture site for 5 minutes or until bleeding stops. Apply firm pressure for 10 minutes if the patient has a history of increased coagulation time. Hematomas following an arterial puncture can cause circulatory impedance, discomfort, or can predispose to infection. Or can apply ice pack to help decrease persistent bleeding. Next, protect blood sample. Hold syringe uptight, express any air bubbles rapidly. Seal needle immediately using rubber stopper or cup. Air bubbles may alter laboratory test results. Specimen must be kept airtight to prevent alteration of test results. Roll the syringe gently to mix blood and heparin. Next is immerse blood sample in enough ice for transport to laboratory. The use of ice reduces temperature of the sample to below 4 degrees Celsius and slows the metabolism of oxygen and delay longer than 2 minutes alters values. Next, Label specimen, complete appropriate laboratory requisition, note the percentage of oxygen therapy if applicable, the temperature especially if elevated at the time specimen was drawn. Specific information related to sample collection enhances accurate analysis of results. Lastly, expedite immediate laboratory services. No test results for any specimen, even if chilled, can be accepted as reliable if sample is tested more than 15 to 30 minutes after arterial puncture. That's all for ABG analysis. Thank you and God bless.